Today we have Paula Schubert here, who has been treated with Disclusion Time Reduction. This is her 1-week follow-up appointment, and I've asked her to report on her symptoms and what she came in with and how she's doing after 7 days.
I had a lot of dental treatment done about 2 years ago. I had some crowns and some overlays and inlays done on all quadrants of my teeth, and after that my bite was just completely off, and I had a lot of pain in biting, a lot of heat and cold sensitivity, particularly cold sensitivity, a lot of difficulty relaxing my teeth and jaws, even just when I was not chewing, just in a regular holding pattern, and agonized basically for 2 years, wondering what I could do. And I happened to come across Dr. Kerstein's information on the web and knew I had to get in here. And 1 week post-treatment, I feel as though my jaw has completely relaxed and has been allowed to come forward more. I was particularly feeling a lot of sensitivity on the left side, but it feels so much better now.
Cold sensitivity?
Cold sensitivity has started to decrease. I'm much better able to chew harder foods, things like broccoli or carrots or things that have more snap to them, nuts in particular. Where before I really had to baby them and practically suck on them, now I can actually bite on them, which is just amazing to me. So I feel there's just been a tremendous improvement.
So what treatments did you have after the crowns were made? You had the dentistry done. What did you try to do for help?
So actually I went back to the original dentist several times, and he would use the blue tapes and just try to grind down the teeth just from looking at the regular blue tapes. Like I said, I probably went back to him about 4 times. And I was classified as someone who had an extremely sensitive bite, which just annoyed me because I knew there was a lot more going on in my mouth than that statement. I felt as though I was sort of being dismissed a little bit. And then I tried 2 other dentists who were very sweet and tried to help me, but I just could not get the relief that I now feel from this procedure.
And did they use carbon paper only?
Yep, carbon paper only. There's no other.
So they didn't use computerized bite analysis?
No computerized bite analysis, no. And in fact, the first dentist, the one who actually put the crowns on in the first place, I can't remember the name of the instrument, but TENS, I think it was called, yes. Where they try to relax your jaw so that you are biting, and I guess would be your normal pattern. And he would use that in conjunction with trying to do the carbon paper, but it was not helping me. That wasn't helping. That's
where they would relax your muscles, putting these on your face, but you would get pulses.
Yes, the pulsations. Right. Yes, exactly.
And that had no therapeutic improvement?
It didn't. And in fact, I told him to stop using that because I felt that it wasn't representing what my bite was actually doing without it. And even though he thought maybe it looked okay when using that machine, when I would go back to my regular life, it was obvious that I wasn't able to bite in that same fashion. So I was still having tremendous forces on my teeth that were making it miserable for me.
Anything you would like to say to another patient who might be thinking about or have these kinds of problems?
Yeah, I would highly recommend it. I think the therapeutic value is tremendous. Just the relaxation response I've been able to get in just this 1 week is so worth it, and I'm so happy that I found Dr. Kerstein, and I would suggest anybody do it if they feel the need.
And you don't wear a splint?
And I don't wear a splint. No, I don't sleep with a splint at all.
Terrific. Thank you very much.
Thank you.